Hey YouTube, it's Eric, and I am coming at you with my post-consultation visit notes and experience. Many post-opers out there probably skip over this video, but anyone looking to get more information about what happens at the visit and what to expect after your consultation, park it right there because this video is for you. So, I go in, I meet the surgeon, and the meeting with the surgeon was actually quite short. We just talked about me, my eating habits, my exercise habits, and what I'm looking for out of the sleeve, and making sure the sleeve is right for me. So after that, I actually meet with the program coordinator. And that's where I spent most of my time, just going over everything that's going to be involved. As you probably know, my insurance requires 3 months of a multidisciplinary program to be followed in order to be considered approved for the surgery. So with that said, there's a lot of tests and everything that has to be done at first as well. Just to go over all of that with you guys. Let me see here. So first things first, which I didn't think that I was gonna ever have to need, but apparently you're gonna. Again, I guess it makes sense. I need to get a primary care doctor. I never had insurance until this year, so I never had a primary care doctor. I just went to the ER if anything was wrong. And thankfully, I'm in good health to where I rarely ever visit the ER. But in any case, I do need to have a primary care physician fill out this form, and this form clears me for surgery, which is nice. The other visits that I need to have a pulmonary evaluation, a psychological evaluation, a nutritional visit, and a physical therapy visit. I haven't heard many people talk about physical therapy in their experiences, so I did ask about it and tried to find out why it was necessary. My center is completely encompassing of everything from soup to nuts when it comes to bariatric surgery. So they have, of course, the surgeon and the team, the coordinators and whatnot, but all these tests that I need to have done, and even the primary care doctor, are all in the same building. And the physical therapy, from what I understand, is to make sure that I'm physically, there's some sort of walk test, from what I can understand, to make sure that I'm able to physically meet the demands after surgery. I don't know. To me, it just sounds like an extra copay, but whatever. But anyway, like I was saying, it's all encompassing. They even have plastic surgeons, for later down the road if I wanted to have a body lift, if I needed it. So everything's there, which is nice. The psych test, I am happy to learn that they actually use a psychiatrist or therapist. I don't know which one it is. I'm assuming it's psychiatric. I can't even talk. It's not a test, is what I'm trying to get to. I hear a lot of people say that they're handed a 300-page test and they're supposed to fill out the answers, and that's that. I much rather see somebody face to face because I really suck at tests. The nutrition visit is with a dietitian. And I meet with her twice during the entire pre-process before surgery. Once initially, and then once right before I'm cleared for surgery. And in between there, I'm meeting with the program coordinator, and we go over the multidisciplinary thing that meets the insurance requirements. So, I like the way that this is going. Like I said, everything is encompassed into one center so that I can actually have everything done on the same day. However, if I chose to go down that road, I had to wait a month. They were booked that far out. and I much rather have this done sooner than later. So my initial nutrition visit and my physical therapy visit, I'm actually having that done next week. And then the psych and the pulmonary, that's getting done the week after. I much rather have the first visit on the books so that I can get the surgery on the road and going. The other visits that they were, tests I should say that they require, is for obviously your lab work. You want to make sure you get that done, and they should give you a script for that. And something called an H. pylori test. I had never heard of it. I never heard of anyone talk about it either. But the H. pylori test is basically a swab that they do, from what I understand, that tests for some sort of bacteria in your stomach lining that can, cause problems. And they need to make sure that's not present before they actually have surgery. So I have to have that done, as well as the blood test. And then after that, I also have to have an upper GI. So I have all three of these things scheduled for next week. I'm trying to bang everything out, get it done, because I'm ready just to go. So that's that. I even have my follow-up with the program coordinator scheduled for February 5th. So at the end of this, before I'm clear for surgery, they would like to see me lose anywhere from 13 to 27 pounds. That's 5 to 10% of my body weight. And I did ask the question, well, I do weigh 277 and my height is 5'8". My BMI, it's over and it's considered, I don't need to have a comorbidity to be approved, but, I'm just a few points away from, going down to the level below where I would need a comorbidity. And my program, I can't even remember her title. Let's see here. Program coordinator, she said that the initial weight of the 277 is what Aetna will look at, and not the weight lost. So I can lose as much weight as I want now before surgery, and I'll be okay. So that's exciting. So they gave me a sheet to track my meals and my water, my protein, everything, to make sure that, I'm eating what I should and sensibly. I must say today I kind of sucked at it because I didn't really look at this sheet until later in the afternoon. And there's specific things about, making sure you eat 2 hours after you wake up, and different things with protein. And so tomorrow will be a better day. So that's that. That was pretty much the visit, and that's all the follow-up stuff that I'm running into. Like I said, the only thing outstanding that I need to do is set up my primary care doctor. I need to find one first, and I preferably like to find one that has online scheduling. I know that sounds really lazy, but I just hate making phone calls. Worst comes to worst, I'll pick up the phone, I'll call somebody and get an appointment. But so that's that. Almost at 9 minutes. So I guess I'll talk to everybody later. If you have questions or comments, leave them below. And if you're not subscribed, feel free to subscribe. I'll talk to you guys later. Have a good night.